Hi, I'm Dr. Seiler again from Seiler Skin in Homewood, Alabama, and this is the third video in a series. The first video showed a quick numbing shot that I do inside the mouth for filler, and then we did some Botox, and that's a separate video. And so she's had this done before, and we're going to put just a little bit of filler in what we call the nasolabial fold in the corners of her mouth. You can see how easy of a treatment this is. I do just a little bitty numbing shot in the mouth that she didn't even really feel. She's had this done before, in March of last year, and actually has really seen a good result with it, and really just needs a little bit of a touch-up. So, all right, you ready? Mm-hmm. You can see that my nurse iced really good before we did this, so this helps to not only make it a comfortable treatment. You feeling anything?
Mm-mm.
Good. Once I do that numbing shot, usually you're completely numb. The icing also helps to really reduce the chance of bruising, and we take a lot of time to ice before each area, and then we ice afterward, and we hold good pressure. And kind of massage it a little bit, and I hold pressure after each little stick here to make sure. You can see that she's had Botox done in the upper face and the forehead between the eyes and around the eyes, and you can barely even see where I stuck for the Botox. So this is something that she shouldn't have any downtime from. I always warn patients that they can have a little bit of bruising with this, but generally not. You can see this is a pretty easy injection. This area I usually can get completely numb with the numbing shot, so generally patients don't feel anything at all. Okay, open up for me. I'll do a little bit of molding here just to make sure it's nice and smooth. When Juvederm is done correctly and put in the right area and in the right depth, it should give a really good result, and it is not something that patients will feel. Alright, we're going to just ice here in the corner of the mouth there. I'll hold pressure up here. So icing and pressure before and after the treatment is really the key to making this a bruiseless treatment, but still a really good result. We didn't really numb the lower corner of her mouth too much so that we didn't make her too numb afterwards, so we iced really good before, and she really shouldn't feel much. She might feel just the beginning of a little stick. You can see that I kind of wiggle a little bit here to kind of distract her. And you feel much there?
Mm-mm.
Not too bad?
Nothing.
Good. So this helps just kind of elevate the corner of the mouth. If you start to notice with age that corner of your mouth kind of starts to turn down a little bit, maybe not into a full frown yet, but just if you've lost just a little bit of volume, this is an injection that can really help just kind of give you a little volume back here. And then we'll put just a little bit in the lower lip line. This helps with fine lines in the lip, but also just to kind of elevate the corner of the mouth. I can also put it a little bit lower on the jaw. Okay, open up for me. Make sure it's nice and smooth in there. We're almost done in her, so we've only used about not even half a syringe. We'll use the other half on the other side, so we won't really shoot that in the video because it'll be the same injection, but you can see that this is very easy for the patient to get through. They can return to normal activities right after. They can wear makeup right away. They can do whatever they want later that day, so it's not difficult to get through. You'll see from some of my other videos, some of the liquid facelift videos that we have for both Juvederm and Voluma, which just came out. We can inject under the eye. We may come back in this patient and do just a little bit of filler in her upper lip and under her eye if she feels like she needs it. That can help with just the beginnings of hollowing under the eye. We can put it under the eyebrow to give a little eyebrow lift. We can put it all through the cheek. She doesn't really need any in her cheek. She's got a good cheek. So there's all kinds of stuff we can do with this just to give a natural look but kind of return a more youthful look without any downtime. So thanks a lot for watching.